All right, welcome to the 19th Job Service Training webinar. If you haven't already done so, please type your first and last name in the chat box for attendance tracking. If you don't see the chat window, move your mouse over the PowerPoint slide here, and there should be a little dialogue symbol, a little dialogue word balloon symbol that would allow you to see the chat box. We will use the chat box for questions. If you have any questions as we're going through here, please send them our way, and Carrie and I will we will monitor that and address your questions as you come along. And we do encourage questions today. If you ever experience difficulty connecting to the audio of these webinars, I know if you can hear me now, it's not a problem, but in the future, in the upper left corner of this, there is there's a little information thing that will show you the call-in numbers. Calling in is the best way to connect to the audio of these because laptop microphones or microphones that are coming out of your computer don't always project your voice as well, and sometimes can make it hard for you to hear the local audio. So whenever possible, use the online or call me features of the audio to connect with that. So the purpose of these webinars is primarily to train and update job service staff and with information and changes affecting our work. But we always welcome our partners from the counties, from Veteran Services, our ESEA, Invoke Rehab, and others who are interested in the content because we frequently focus on topics that are not specific to the job service program but are helpful for everyone in career force. And today is a great example of a topic that is helpful for all. We're going to discuss resources to assist homeless individuals or people at risk of homelessness. So our agenda for the day is we're going to start out with some brief announcements. Then I'll hand off the presentation to Carrie Marsh, who is going to introduce herself and give us some information on the subject of homelessness. And she'll also bring in a couple of guest speakers from the continuum of care who will provide insight into that. And you'll also learn a little bit more about what the continuum of care is and how they can assist us as a partner in our career force locations. Next month's webinar is scheduled for the last week of August, and it will focus on veterans. We're going to talk about veterans priority and what that means in our day-to-day work. We'll talk about the online and paper questionnaire forms, the Veteran Services Program, the difference between DVOPs and leavers, Disabled Veterans Outreach Program representatives and lead veterans employment representatives, and other related topics. So some announcements in case you missed it. Lori Janatopoulos has just completed her first month as our new director. She may pop in at some point, and if she does, we'll allow her to welcome us in. She is very interested in this topic and has worked on the goal of reducing and eliminating homelessness in her past, and is very supportive of us doing what we can to learn more, to find out new resources and opportunities, and to address this topic. But now that Lori is on board, Wagner-Pizer Job Service, the Veterans Programs, the Career Force Web and Branding teams, and the MinnesotaWorks.net team are now under her leadership in the brand new Career Force Division. We're no longer a part of the places where we used to come from, employment and training programs, or the workforce. I think some of those people may have reported to the Workforce Center Coordination Office. We're now under the Career Force Division. Lori started with a giant to-do list of things to catch up on, as several of these teams have been in an interim role for several months. But she's currently working through the hiring process of the Veteran Services Director and the Job Seeker Services Director, and hopes to have those positions filled and on board as soon as possible. Another update for you, the Standardizing Workshop work group is getting ready to hand off their PowerPoints, and they plan to do so and be ready to do so by July 26th. Our next steps will be to work with the Career Force and branding team to develop the finalized documents, materials, PowerPoints, facilitator guides, and other helpful information. and then bring those to the Job Seeker Services Committee of the Minnesota Association of Workforce Boards, or the MOB. In the meantime, if you're interested in reviewing any of the current draft documents, or if you'd like to try them, because they have been tested from time to time, we welcome that, as many opportunities as we can to refine these workshops is a benefit to us. So let me know if you have any questions about that or need access to where we are storing other documents. Just a side note, I'll be out of the office next week, so the rest of the time to get a hold of me is going to be sometime today, or I will be back in the office on July 29th, and we'll still have access to those draft documents at that point as well, too. So I'm going to, in just a moment here, I'm going to hand over the floor to Carrie Marsh, who's going to lead us through a presentation on the homelessness. If you've been paying attention, you've noticed that homelessness is a huge priority for Governor Walz and Commissioner Grove. We in Job Service have always done our best to serve every customer who comes into our office from the various different populations, but there's always opportunities for us to improve our services, especially with this population that has been fluctuating and is currently on the rise in Minnesota. So as you learn about this population and the opportunities we have to serve those impacted or potentially impacted by homelessness, please consider any ideas that might come up, any questions or concerns, and bring those to your local leadership for consideration. With that, I'm going to turn the floor over to Carrie.
Great. Thanks, Mike, and thanks for having me present today. My name is Carrie Marsh, and I work here at Deed in Performance Management. This is sort of a side interest of mine. I'm working to organize the agency's efforts in partnership with a lot of other Deed staff. The title of the presentation is Housing Instability in Minnesota, and the focus is really for job service staff to learn a little bit more about homelessness than maybe what they already know, and some ideas on how they can assist people who walk through the doors. I'd love to hear chat back from people who are on the call today. So first question I have for people out there is, have you heard of COC before? And have you heard of HB 101 before? Feel free to just chat either yes or no, or I'm not sure. The goals of the presentation, as I mentioned, are really to learn about a little bit about homelessness. Can you do the next slide? Yes. And Deed's role in how we play it, because we're the job people, right? We do employment, we're not housing people. Nothing's changing there. We're still the jobs people, and we don't expect everyone to become an expert in housing or homelessness. But with a little information, you'll be equipped to make some referrals. Haven't heard of it. All right, thanks. I appreciate those chats. And learn how job service staff can help individuals experiencing homelessness. We know that probably almost everyone listening today has some story of somebody that has come into their office that they've been able to identify as homeless, whether it's been a single adult, maybe a family with children, or maybe a youth or young adult. So we'll learn how to ask the right questions, learn about your local housing support network, as well as reducing barriers to employment services. So we'll have time for questions in the middle, and we'll also have time for questions at the end. But one of the questions I usually get is, how do you define homelessness? And that's actually a fairly complicated question. There's lots of different definitions depending on the federal or state program that you're working with. That's why we like to talk about housing instability, because it really, we want to think about how we're assisting people who are either homeless right now, or maybe about to lose their housing, or might, because of a loss of a job, might have some housing instability in the near future. And that's where I think you can see your role. Homelessness often means somebody who doesn't have a place to sleep. It could be, they could be sleeping in a car, in a park, in a campground, maybe on a train or a bus station, or they might be in an emergency shelter or a time-limited transitional housing program. They also may be fleeing domestic violence or living doubled up or couch hopping even with a friend or family, it could be a very sort of unstable situation for them. There's also people who live, migrant farm workers who may also be considered homeless. So it can look like a lot of different things, lots of different situations, lots of different types of people. And so questions you might want to ask when you're talking to someone, instead of asking if they're homeless, we recommend that you say things like, where are you staying tonight? Or do you have a safe place to sleep? And that's a better way to sort of gently inquire if someone might be experiencing housing instability, and if there are some resources that you can help connect them to. Thanks, Mike. So DEED is a member of the Interagency Council on Homelessness and has a renewed commitment to its role in helping to prevent and end homelessness, primarily through one of the 7 principles, which is around increasing employment and income for individuals experiencing homelessness. Across the state, we see homelessness in really about every region. This map shows the continuums of care, and I'll let Jennifer Prince, who's the director of the Southeast Continuum of Care, to tell you a little bit more about what the continuum of care is. I see in the chat box somebody's mentioned DB 101. Yes, HB 101 is really about the same thing. It's a little bit more focused on housing resources than disability resources. But as you see, homelessness is found in just about every area of the state. The homeless response system is divided into continuum of care. That is a lot like how we think of our local workforce development areas. I'm really excited about our guest speakers today. As I mentioned, Jennifer's here. In addition, we have Desiree Dyke from the Southeast Career Force. In addition to sort of the number of people across the state who are experiencing homelessness, I wanted to point out the rise that we're seeing in students who are experiencing homelessness across the state. It's been quite a dramatic impact over the last 10 years. In addition, the effects of being homeless are especially hard for children. It turns out that we have a lot of negative outcomes, such as health problems, both physical and mental health, increased exposure to violence, maybe likely to repeat a grade and have more disciplinary issues. That affects students' ability, homelessness affects students' ability to learn, as well as that leads to issues in future employment. However, we do know that quite a few people who are homeless are working. There's a common misconception that people who are homeless do not have jobs and are not interested in working, and the Wilder survey that occurs in Minnesota every 3 years has found that that's simply not true, that around 1/3 of people are typically working and employed, perhaps not full-time employed. We'll talk a little bit about the barriers that people who are homeless face to employment towards the end of the presentation. One of the questions on the chat is students. These are public students K through 12. Thanks for the question. Finally, we can't talk about homelessness without mentioning the racial disparities that we see. This slide represents 4 different points in the population. The first point is the general population in Minnesota. The second point is those that are housing cost burdened, which means paying more than 30% of their income for housing. The third point, where you start to see the different racial and ethnic groups split apart, is poverty. And then that very last point, where you really see a large gap or disparity, is the Minnesotans experiencing homelessness. We see that American Indians or Native Americans experience homelessness at 13 times the rate of the general population, and African Americans at 7 times. So it's important to note, as we are fighting poverty, that the disparities that we see in homelessness are even greater. One thing, no, we don't have veterans. We do have, thank you for the question, Stephen. Veterans is a very important part of ending homelessness. It's been a priority population, and there's been a lot of efforts over the last, I'm not sure how many years, 6 years, to really focus on ending veterans' homelessness. Minnesota's made some great efforts, and Jennifer might be able to talk a little bit more about that. There's been some areas where they've declared an end to veterans' homelessness, and Minnesota's working hard to do that for the entire state. But we're not quite there yet. I know there's, I think, around 300 or so veterans, but I'm not precisely clear. We can look that up for you, Stephen, and get back to you. I just learned about a brand new tool. This is called Youth Service Network Minnesota, and it was developed by the Bridge for Youth in collaboration with 12 other agencies. This is for the metro area and for youth, but it's a really exciting tool because it provides real-time shelter bed availability. So if you have a youth or young adult in your office, you can connect to this or have them connect to this, and they can find a place where there is a bed instantly available or in real time, so you can find out if it's available. There's also connections to things like health and wellness, food, and other basic needs. So brand new, exciting tool if you're in the metro area. And with that, I'd like to turn the presentation over to Jennifer Prince. Jennifer, I'll let you introduce yourself and say a little bit about what you do and why it's important for our job service staff to get to know a little bit about the continuums of care.
Sure. Thanks, Carrie. Can you hear me? Just making sure before I launch in. Okay, perfect. Yes, good morning. Thank you for having me. We're really excited to talk to you. I am the coordinator for the Continuum of Care region that covers most of South Central and Southeast Minnesota. So communities in that area include Mankato, Austin, Rochester, Red Wing, Winona, Northfield. So pretty much everything east of Brown County and New Ulm. So our region is a large region. It's 20 counties. And for this region, we are a recognized continuum of care body that it's recognized by the U.S. Department of Housing and Urban Development, HUD. And so we are considered the local planning body to coordinate housing and services for people that are experiencing homelessness in our region. And so in that body, we engage a lot of different types of agencies and community partners that play a role in supporting our effort to end homelessness. And this includes youth programs, it includes county human services, includes shelters, faith and church communities, nonprofits, schools, legal services, housing authorities like public housing agencies, domestic violence programs, and workforce partners as well, people like you. And so we know that there's a lot of reasons that people can become homeless, and there's a lot of ways that we need to work together to support people who are seeking to end their homelessness. And in our region, we currently have identified over 1,500 households that need assistance to end homelessness or are right on the edge of becoming homeless. And so those are people that you may encounter as well. So you can see here that on the slide that we have several different roles for our continuum of care and things that we have to work to develop so that we have an adequate response system to be able to assist people who are experiencing homelessness. One part is the outreach intake and assessment, and that's really identifying people that may need assistance and trying to connect them to the resources that they need. And that may be an area where you may be able to play a role. You encounter a lot of people that may be experiencing housing instability or homelessness. And so you may be a key point in that person's life and be a key connecting point to some of the housing resources that they might need. Some of the housing resources that get that are part of the homeless response system are listed there. Emergency shelter is meant to be very short term. And for example, in our region, we have very few shelters, and those that we have are mostly seasonal shelters. And so that does affect what resources you can identify for people that you may be encountering. Beyond emergency shelter, there's transitional housing, and that provides a little bit longer assistance. It's targeted for people that have a few more barriers to becoming more stably housed. So, for example, maybe there was a job loss or a medical emergency or domestic violence or other things that may lead to the need for support for maybe 6 to 24 months to really kind of get back to housing stability and be able to move forward in their lives the way that they would like to. And so that's really where transitional housing fits in. Permanent supportive housing is really geared for people who have really significant barriers to housing stability. So it may be people that are experiencing chronic health conditions, that have serious mental illness, that maybe have significant criminal histories that present barriers to housing. And a lot of these barriers overlap and affect each other. And so the permanent supportive housing really comes along with some intensive services to support that housing stability as well. So those are the types of resources that are connected with the continuum of care. And so when you, for example, are identifying someone who's experiencing homelessness, by connecting with your continuum of care contacts, it can essentially direct people and help to match them to the resources that they most need. And I will say, we all need more resources. It's not necessarily a super quick process all the time, but this is the way that people are connected to housing and services. So why coordinate? Obviously, we've been talking a little bit about where our connections are in preventing and ending homelessness. And there is an interdependence between employment and income and housing stability. We also know that we all need each other to do this work. None of us can be the experts in everything. None of us have the skills and the resources and the capacity and even the stamina to do everything. And so by working together, you in your world can be the experts and do what you do well in terms of supporting people to become employed or increase their income. And those of us in the housing world can do our work well to really help to bring around the best of those housing resources that can support people as well. That way we are not duplicating services, and it really makes sure that we are effectively using all of the resources that we have. And by working together, we can also help to document where those successes are. And that can make us more competitive in securing additional resources to support those in our communities that do need housing stability and can use employment and income to support that. Next slide. So yes, how do you coordinate? Talking to each other always helps. As we mentioned before, there are 10 regions in the state, 10 different continuums of care, and we all respond to our local needs a little bit differently. And so I know I did send to Carrie, and I don't know if this has been sent out already, but it can be afterward, the contacts for each of the 10 continuum of cares in the state, and this is a great place to start. I will say, these contacts here are the coordinator contacts, and so they are not going to be the people that can immediately assess someone and connect individuals to resources, but they will be able to help you identify what your best local contacts are. So for example, in our homeless response system in our region, we don't have one main phone line that people call. We have a no wrong door access process where we have specific agencies in every county that are identified as assessment points to coordinated entry into those homeless and housing resources that we mentioned. Other regions do have those main phone lines, for example. And so by contacting your coordinator, you'll be able to find out what your best process is for your local resources and where to connect. So here's just a quick summary of coordinated entry. You may have heard of this, you may not. Essentially, what coordinated entry is meant to do is it acknowledges that we probably don't have all of the housing and support resources that we need to meet the needs of everyone who's experiencing housing stability in our regions. And so what we need to do is to prioritize the resources that we have to those who most need it. And so this coordinated entry process uses a common type of assessment that all of the agencies in the region share, so that there's one assessment that's completed. An individual experiencing homelessness doesn't have to go from agency to agency to be assessed and reassessed and see if there's openings and things like that. What happens after assessment is that there's a prioritization process. So when people are assessed in coordinated entry, it's not a waiting list, it's a priority pool. So essentially what happens is that when a housing opportunity is available, the households that have the highest need and that match the eligibility for that type of housing are then referred for that opening. And that's the entry point to housing at that step. And most programs that receive state and federal funds do require use of this coordinated entry process for access to those types of housing and services that are designated for people that are experiencing homelessness or other housing stability, like Carrie mentioned. Excuse me. Next slide. I don't know if there's another. All right.
I think we can take this slide here, Jennifer, and we'll keep you in on the line here too. And if you don't mind, muting your own phone line if you're not speaking, and then that way I don't have to work the background magic here. But at this point, I'd like to just talk a little bit about how job service can help in this regard and in working with the continuums of care, the COCs. And one of the things that I see as an opportunity for us is to work with the COCs in a similar way to how we work with other agencies. Job Service has a history of partnering with a variety of organizations depending on our locations. Sometimes we're located in county service offices, sometimes we're located in colleges, sometimes we co-locate with partners who do other WIOA programs or ABE, Adult Basic Education. And when we partner with those programs and are working alongside of those programs, we often go in and do presentations to those different groups. We may get to know some of the other staff. And when an opportunity to co-enroll people and work together arises, we make direct handoffs back and forth. And that's really how I see job service can help in this regard. We can connect more with our continuums of care committees. We can attend meetings, possibly provide updates about what job service can do or what career force locations can do for this group of people, just like we do if we're going to an adult basic education center and providing job search help to people in classes there. So developing those partnerships with the housing providers, knowing so that when somebody is identified as experiencing housing instability, and I really do like that term, that we could connect people up with those providers and resources a lot better and a lot quicker. And that will also, in every situation where I've experienced this, connecting with people and learning more about the other services also helps to bring more customers to our locations and brings more customers for our program. As those people who need our services can be more aware of the things that we do as well. So referring people back and forth between coordinated entry and other things. So look for opportunities to do that. Work together in your locations to find out ways that we can learn more about the services available and how we can connect better with them. With that, we'll come back to you to take us through the next section.
Thank you, Mike, and thank you, Jennifer. That was really excellent. I thought that was a really good overview. I'd like to pause for just a few seconds and see if there are any questions or comments. Does the audience feel comfortable with how to refer people to coordinated entry or when they would refer to coordinated entry?
Yeah, so
I'd like to hear in the
chat box. Yes.
Thanks.
And we will sit here uncomfortably for 15 to 20 seconds while we wait.
And any other questions are welcome too.
Absolutely, yeah.
Okay, great. MacV is great. He feels comfortable referring. Yes, we'll get everyone a copy of the contacts just after this presentation is over.
Following this meeting, we will I will send out again this presentation and also that attachment that we just put up there with the contacts.
And just in a few minutes, I'll show you all another way to access that information online as well.
Excellent.
Okay, well, keep the comments and questions coming, please. I'm going to move into the next section, which is focused on foundational service practices. These are 5 service strategies designed to improve our work to offer employment and training services to people who are experiencing homelessness. These foundational service practices were developed by the Interagency Council on Homelessness and in partnership with other stakeholders. They're intended to be relevant to all state partner agencies. So these aren't specific to DEED or workforce, but I think you'll see the relevance to your work. A key theme that they heard is what's hard for people who are housed is impossible for people who are homeless. This refers to the fact that many intakes or application forms or appointment requirements assume that someone has an address, has a car, has an appointment book, or has their personal paperwork on hand or easily attainable. And for families and individuals who are homeless, that's simply not true. So the 5 foundational service practices are, number 1, know the housing status of the people you're serving. Ask participants if they would like assistance with housing as a regular part of your conversations, and then have the resources and information available to refer them to. We're doing that part today, providing you with that information. The advantage of this is not only do the people do better, and they also will have better employment outcomes because housing is really the foundation for improving employment as well. Number 2, actively reach out to people experiencing homelessness. This might look like locating services in places where people experiencing homelessness are, such as an emergency shelter, a permanent supportive housing program, or other type of housing program, or a library. And we'll talk more about that later. But the message behind this principle is that finding and getting to resources can be really complicated when you're in crisis. It can be confusing, and so when you bring services to where people are, it helps make those connections and helps deliver the resources to people who need them the most. Number 3, limit the requirements for in-person appointments at a particular location or office. Again, these are sort of broad recommendations, but if someone misses an appointment because they're homeless, try and be flexible, try and be understanding. If someone has to appear in person, if that's a requirement of the program, have flexible hours available, and minimize the number of times that people need to make in-person appointment. Mike, do you want to speak to that one at all?
Yes, yeah. We in job service are frequently meeting with our customers one-on-one. And really the only requirement we have for them to meet with us is to be registered in minnesotaworks.net.
Okay.
And with that can be difficult if you don't have a permanent address. The nice thing is that with minnesotaworks.net, we have allowed people to use whatever mailing address that they would need in order to complete that registration. It's not verified. We don't need it to mail them anything. So if they need to use a place that they're staying, or even if they have to use the career force address of the place that they are right now just to complete the setup, that can be a potential way to get through that, or just filling something out in the street address. And so we can limit those requirements needed to meet with us. And additionally, we do still strongly encourage one-on-one meetings with our customers as they're coming in and to help address these things. So definitely, I think that we are well suited to making our services very accessible to people in this situation. And I see a couple of comments came in while we were discussing that.
Great.
Oh, from Jennifer. Do
you want to read it, or should we?
Yeah, let's see.
Why don't you read it and I'll keep talking?
Okay.
Or do you want to read it out loud?
I think everybody on the chat in this can read it for themselves.
Oh, really?
Yeah.
Okay.
Yeah.
But what about the people recorded later?
Oh, I suppose we should read it for them.
Okay.
Yes. So MACV is a great partner and an active part of the homeless response system and across the state. They are an access point for veterans experiencing homelessness. And other agencies can assist veterans to access both veteran-specific resources and general resources. Our goal is to ensure that veterans are connected to any and all resources that might help to end their homelessness, whether those resources are veteran-specific or not. And I know that MACV is making a really great connection to several of our career force locations, and we hope to see that trend continue.
Great. Thanks, everyone. Appreciate the comments. The fourth foundational service practice is to assist with the process of gathering required verifications or documentation. I think this might be obvious, but when someone is experiencing homelessness, they don't have a safe place to keep their paperwork, like a Social Security card, birth certificate, or even driver's license, and all of those documents are more at risk of theft. I'll talk a little bit more about a potential resource to help have those documents in a secure place in just a moment. The final foundational service practice, number 5, is to allow for multiple methods to communicate about benefits and services. Mail is something that's sort of out of date now and used less frequently, but that was something that was a big barrier, 10 years ago for people who are experiencing homeless. A best practice is to ask people what method of communication they prefer, whether it's email or phone or something else, and then honor that preference. You may also want to extend an option to have somebody provide a third-party contact in the case that they can't be reached personally. In just a moment, we'll hear from Desiree Dyke, who's a career planner at Workforce Development, Inc. in the Southeast region, and how she implemented some of these foundational practices in her work. But first, I'd like to introduce you to a website that's called Housing Benefits 101. It's a collection of Minnesota-specific resources for anyone worried about or wanting to improve their housing. It includes a secure online vault for storing personal identification documents. This is a screenshot of the website. Housing Benefits 101 offers individuals information about a variety of housing resources, so including like Section 8 and other housing voucher programs, ways to avoid foreclosure, some rapid rehousing or emergency assistance. And if you look at this fourth section, it also has homeless services in Minnesota. You can go there and find all of the coordinated entry contacts across the state, as well as the COC information or continuum of care. So this, just to reiterate, this is not just for homeless. It includes prevention of homelessness, items about housing affordability, and it's a great resource that you might want to share with people that you're working with. Now I'd like to turn the presentation over to Desiree. She will talk about her use of the foundational service practices and how she implemented them in her work, and then we'll have some time for questions.
Hi, thank you. Can you hear me?
Yes, we can.
You can?
Yes.
Okay, good. As she mentioned, my name is Desiree Dyke, and I am with Workforce Development Incorporated. We are a nonprofit agency who has offices in 10 out of the 11 counties in southeast Minnesota, and our primary function is to provide employment services and training through a variety of different programs. Some of our programming would be all of the welfare reform programs, so anybody who's receiving cash or food assistance typically is working with us for those requirements. We also have a dislocated worker program that is state and federally funded, where we work with the employers and the employees, helping kind of see what other opportunities are out there, kind of retrain those individuals and get them back into the workforce. And then we also have adult and youth training programs where sometimes we can provide work experiences and other opportunities to the youth in our area as well. As I mentioned, we are in 10 counties out of the 11 in southeast Minnesota. We are co-located in a lot of the career force locations, so we are a partner with Job Service. Some of our other counties, we are just an independent office, but our services are open to anyone. We do triage all day, every day in all of our offices, which means anybody can come off the street, walk in, and we can help kind of assess them, see what they need, make sure they're connected to the right resources, and then also see if they're eligible for any of our programs. As I mentioned, when an individual comes in through programming, we do provide a universal assessment. So we do kind of have that whole conversation with them about every aspect of their life, just to try to find where the barriers are, what their goals are, and then develop a plan off of that. So, there are quite a few individuals that do come in that have a lot of barriers, whether it's housing, transportation, childcare, healthcare concerns are big, mental health, chemical health. So just definitely connecting with them and working through those things so we can help move them into the job search employment piece. A lot of our programs are employment focused, so we really have to focus on helping them overcome those barriers in order to move into employment for self-sufficiency. Some of the services we do provide are a lot of work readiness training, short-term training, whether it's a 2-week course up to a 2-year program. A lot of career exploration too, kind of seeing what are other options that they can look at just to try to make a livable wage. Regarding the continuum of care, workforce development has definitely been a part of that, and they're a great resource, great providers and agencies that are within the continuum of care that we work with quite frequently. The individuals that are having to kind of overcome some of those barriers definitely need to be connected with other providers. So we take the time to set up appointments, whether we're calling or we're giving them the information. If there's any way we can assist with appointments, sometimes like vocational rehabilitation will come into our offices and meet with the person so that person doesn't have to try to get to a career force location. Housing lists are definitely a big thing too, connecting them with Section 8 housing. A newer thing that is kind of happening within a lot of the counties is a housing navigator. So an individual that's receiving any type of service through the county can access assistance through the housing navigator. So that person is able to work with them more one-on-one and trying to move them into housing a little bit quicker than we necessarily would be able to. And just to kind of give you an example of a recent event that happened in Dodge County over the last couple of weeks is there was a lot of flooding going on. So a lot of homeowners got hit twice within a week. So their basements were flooding or they had sewer backup. They basically lost a lot of their belongings and their housing. We do have some landlords that actually evicted the individuals in order to do the cleanup. Some of them can't even leave the property because they have nowhere else to go. So it's been very challenging for them and trying to find every resource we can. So that's where the continuum of care comes in. Reaching out to them and making sure that we know of everything and that we can connect those individuals to the right people. Through that, we've learned of, some great valuable resources as well. So if an individual is receiving food support benefits and because of a flood or a disaster, maybe their electricity went out and they lost everything in the refrigerator, they can actually fill out a form with their county and get replacement food benefits. So anything that was lost can be replaced. So they would get that food assistance benefit on their card so they can go purchase more groceries. There's also several programs in the state of Minnesota that are doing household item replacement. So whether it's furniture or linens or cookware, things like that, they are able to, for small fees, able to help those families out. Some of them kind of giving the whole home replacement too, depending on what has happened. So that's a huge benefit as well. Regarding the continuum of care, we definitely try to stay active with that. We do have a representative in each county who does attend the homeless response team meetings, whether they're monthly or quarterly, just to make sure that we're really connected with all the service providers. We're able to share resources, share other opportunities that, so that way everybody kind of knows what's going on and is kind of current with everything. Also, when possible, attending the continuum of care larger meetings as well. And then the last piece I kind of wanted to talk about was a website most of you are probably familiar with. It's minnesota.gov/DHS. This is the Department of Human Services website where you can access a lot of different documents when it comes to public assistance programs, whether it's food support, cash assistance, health care, child care. On there, if you go under the eDoc library, there's 3 different sections. So it does give you the manuals for all of those programs so you can kind of see, how they function. They do have a searchable document too where you can pull up different brochures for each program, forms and documents. So if you're working with somebody who needs to apply for some of those services, you can access those forms off of there. And then they have bulletins as well. And we rely on this heavily for our programming because that's where we see the changes within the welfare reform programs, things that change regarding the services that we provide that impact the participant. This might be a little more daunting, so an easier way to kind of access some of those services would be a website called Bridge to Benefits. So if you're working with somebody, you can give them that website or you can connect, sit there with them and explore the website. It allows them to go online and actually apply for those benefits. So if they needed the food or health care or cash benefits, they can easily do it right online without having to go to the county and all of that as well. And it will just give them the step-by-step process. So if you have any questions, you can let me know. Thank you.
Thanks, Desiree. That's great. Thanks for all the work that you do to connect people to different resources in your area. I I wanted to share one more resource that people might not know about, which is the DHS document vault. You can find it on HB 101, which is the housing benefits, or DB 101. Someone mentioned on the chat box they knew about disability benefits 101. Those two sites are sort of mirrors of each other, and they both have an online document vault where people can upload their secure, their private information, like a copy of their Social Security card, and store it, and then give people access to it. So whether it's their county worker, or they need it for employment programs, or they need it for a housing program, the individual themselves controls who can access it, but it's always in a safe place. Let's see, and we had, now we have some time for questions and comments. We had one comment come through the chat box that was asking for any suggestions we have about how to talk with participants or potential participants about their housing situation. You know, one approach is to just ask people sort of consistently, like, would you like assistance with any housing, or are you interested in learning more about housing resources? And Desiree, maybe you have other ideas of, you know, what's a nice way to engage people if you're concerned about their housing situation?
We'll definitely having the conversation, you know, about a lot of individuals we work with are paying like $1,000 for rent, and they're renting a house, and they don't realize that they might be eligible for possibly Section 8 housing. So making sure they have that website and that information, or even sitting down with them and doing the online simple application, and that just opens up a huge, you know, shift with their financial budgeting in itself. Or, you know, if there's other places that might be a little bit more suitable or cost-friendly for them, just giving them the housing list, making sure we're working with the cities, because a lot of times they'll have housing lists on their websites, and just kind of knowing where else they can go for deposit or rent assistance, you know, primarily through the county or like the Salvation Armies or SEMCACs. But through our universal assessment, that is part of the part that we do talk about a lot. So, you know, whether we're talking about budgets and housing, then that kind of spawns right into that conversation. But like you said, just asking them, you know, do you have any housing concerns, whether it's with the environment that you live in or the landlord, and just connecting them with the right people.
Mm-hmm. Yeah, thanks, Desiree. That's great. And I'll just reiterate to the job service staff, you know, it's great to know your housing providers as referrals, as well as for them referring to you, but we don't expect you to become experts in housing. And sending people to the coordinated entry, which is connected to your local continuum of care, is a really sort of easy way to sort of help connect people to a lot of those resources.
Right. Yeah, and that, another underlining of that, we're not expecting that everybody knows how to do this themselves or anything like that, but to make a better connection point, because we have had these experiences in the past. I can talk about, you know, experience I had working in a resource room, and a customer came in and we were helping them, and they were trying to apply for a job as it was really important, and they didn't know what to put for their address. And in talking with them, we learned that they had their whole life packed up in their station wagon outside, and their dog and their kid and their wife were waiting for her, and he was just trying to get an application for employment out because he had just been evicted. And we scrambled to do whatever we could to help the person find a place to stay that night. We connected them with some other resources because they had never been in that situation before and didn't know where to do that. And we looked up information. We stayed late. Had we known a little bit more about coordinated entry and continuums of care at that point, which I don't know I didn't know about that at the time, and it was also 10 years ago, we might have been able to better serve that customer, right? Fortunately, we were able to find them a place to sleep that night and get them on the road to addressing those barriers. But so I know that probably if we gave some time here, we could hear a bunch of different stories from people throughout the system who have had similar experiences with those either recently experiencing it or currently experiencing it. And I just think that there's an opportunity here for us to better serve those individuals. Desiree adds that energy assistance is also a great resource for low-income individuals. This helps with utility costs during the winter months, typically up to 4 months. Amount of benefit is based on income. I think that we do a fairly good job with connecting people to different resources and CAP agencies, county services, things like that. And this would be another one of those programs. I'm going to just check and see if we have a guest here real quick.
Oh, okay, great. So while Mike opens the door, if people have any questions or comments or want to share any of the work that they're doing, we'd love to hear from you in the chat box. Or we can also unmute your line if you prefer. I think it's been a good discussion today, Mike.
Definitely, yes. And let's see here. So let's just wrap up here. Again, remember, if there's any questions, please feel free to send them our way. We still have a few minutes here that we can still address and answer any questions. Otherwise, all the people on this call are available for questions directly as well. We will send out that contact list for your continuums of care. Carrie and I are DEED employees, so you know how to connect with us.
And thanks, everyone, for listening in.
Absolutely. So just some wrap-up reminders. Again, another sincere thank you to Jennifer and Desiree and yesterday Laura for helping fill us in and learn more about the resources available to those experiencing housing instability. As a reminder, all job service staff are required to watch these, and you can find all these recordings on our SharePoint. So if you weren't able to pay full attention to these recordings or missed them or missed one, they will all be available in the job service SharePoint. There's a web link right here on the screen. Otherwise, you can also go to the DEN, our homepage on our web browsers, scroll down to agency organization and find them under Job Seeker Services division, and there will be a list of job service training webinars as well that you can use to review the documents, the handouts, and the last one and this one should hopefully be posted by the end of the day today. So if your coworkers weren't able to attend today, we can get everybody in on this as soon as possible. And another comment here. So, and another prevention resource shared by Jennifer Print. Some prevention resources can be found by connecting to coordinated entry. This might include back rent, deposit assistance, et cetera, that can support housing stability or help people get rehoused more quickly. Another great thing that coordinated entry can do for our customers. Just a reminder that our next webinar will be on the topic of veterans, and we're going to work with Ray Duha to put together a presentation on all those services and resources, and also how job service and others can work with veteran customers. As always, we continue to seek your suggestions for future topics. Actually, Veteran Services was one that was suggested from you all in the audience here today, so we appreciate that. So send those my way. Thank you, everybody, and have a great rest of your day, and very soon here, a great weekend. And we'll talk to you soon.
Thanks,
Thank
Mike.
you.